Hey everybody, this is Dr. Leonard with Central Ohio Spine and Joint here in Columbus, Ohio. So today what we wanted to do was show you the process of utilizing our traction spinal decompression table. We've got Ray here to kind of demonstrate for us. Ray came to us about 2 years ago with a very severe herniated disc in his back, pain shooting all the way down the leg, pretty debilitating. To be honest, it was either surgery or decompression. We chose decompression and we've been able to keep him out of surgery over the last couple of years, working full time, playing some golf. So it's done wonders for him. So what we're going to do is kind of show you the process of setting someone up. We'll show you the system itself. So I've already got Ray here in the pelvic portion of the setup. What we're going to do is get him here with the upper torso section. Come on over. Like I've mentioned in the past in videos that we've done before, spinal decompression for us has done wonders for our patients. Not every single person do we accept for spinal decompression therapy. We really only accept cases that we feel like we can help. And for the vast majority of people that come into our office, they respond to kind of the traditional route of chiropractic care rehabilitation. But for those cases that maybe don't respond to some of the traditional routes, are either stuck between surgery and another option, this provides a very good solution for it.
Living proof of that.
And we're going to talk more about Ray's case after he's done on the table here today. What I wanted to do first was just show you the setup, show you what it looks like, and we'll talk to Ray about his experience with it after we're done. Okay, so you can see the setup here. If you want to come on over here and take a look. So this is the screen that shows, essentially the process for Ray. He weighs right around 200 pounds. Typically what we do is we use half the body weight to start. We'll sometimes go up from there. The total treatment time is 30 minutes. And as you can see down here on the graph, this shows what makes decompression so special is kind of that cyclic nature of the treatment where we go out to full tension, we relax, we go out to full tension, relax over that 30-minute time frame. And again, what that does is that provides kind of like a pumping action within the spine. Very tiny little movements. You're not going to feel a whole big stretch with it, but that little motion within the spine can help kind of open up the joints, open up the disc spaces a little bit more. Even some of the research that we've seen come out in the last couple of years has even shown that traction or decompression can actually help reabsorb some of those discs that are in there. So as you can see by the setup here, it's a very kind of gentle, slow pull. You can ask right here. It's very comfortable. Most people actually fall asleep during the process. Obviously, we have cases that come in, they're in pretty significant pain. So it can be a little uncomfortable laying on the table, but for the most part, the pull itself, extremely comfortable, non-painful. So what we'll do next, after Ray's done, we're going to let him enjoy his treatment here for the next 30 minutes. We're going to sit down with Ray and talk a little bit more specifically about his case, his experience he had with it, and we'll go into it at that point. Okay, so we're here with Ray today. Ray's one of our patients here at the office. Like I mentioned, he's been with us for a little over 2 years now, and Ray was kind enough to share his story with us today about coming into the office and his experience with decompression. So like I mentioned, Ray came to see us with a pretty significant disc herniation within his back, pretty debilitating pain. So Ray, tell us a little bit about when you first came into the office.
Yes, when I first came in the office, I was literally in so much pain I couldn't hardly stand to sit and drive. Walking with baby steps, about the only place I could be comfortable was in the laying down position. Dr. Leonard put me through the you know, the normal steps of the beginning care. I guess we went through about 5 or 6 sessions and I wasn't getting any relief, and he said, Ray, you know, let's get you in for an MRI. And he was nice enough, set me up with the MRI and everything. I can't say enough about the care I've gotten at this facility. Came in after the MRI and he said, Ray, you know, you've got some pretty bad herniated disc here, deteriorating. You're really a candidate for surgery. And I had been through several surgeries, wasn't really excited about going under the knife. And he said, well, he said, I do have an option for you. We have a new decompression unit that has had a lot of good reviews. And he said, I think you're a great candidate for it. And I said, well, if there's anything that'll keep me from going under the knife, let's give it a try. So anyway, he signed me up on a special packet. It was a 24 visit packet, and went through about 2 or 3 weeks. I was kind of concerned because I wasn't, you know, really feeling any relief. And Dr. Leonard said, you know, just stick with it, give it some time. And it was like into my 3rd week, all of a sudden, I got up off the table one day and I'm like, man, I feel so much better. And literally by the end of my 24 sessions, I felt like I was back to normal. I've been playing golf, been whitewater rafting 3 times this year, if that says anything. Back to an active life, and the system's done wonders. You know, when I do very active things like the whitewater rafting, or I've been out kayaking, if you can imagine, I'm at the point I can sit like an L in a kayak and kayak. You know, if I start to feel the slightest tinge, I'll come in, get 1 or 2 treatments, I'm back to normal. So, you know, my life's been drastically changed over the last 2 years, and I can't say enough about the facility, the people here. Dr. Leonard's been just a great advocate for me, for all that I've been through, and just really a great group of people. I can't say enough about it, and the system has been a godsend. So.
Awesome. Well, thank you, Ray. We really appreciate you sharing our story. And, you know, guys, this is just one story that we have in here. Ray's is pretty special because, you know, we talked about in the beginning, you heard of me even mention when I said, you know, he came back with this MRI, and I pretty much looked at him and said, Ray, listen, this is pretty bad. Normally I would send you for a surgical consultation. At the time, it just wasn't the best option, so we decided to go through a trial of decompression. I think I mentioned it, you know, when we first did this video, we really do not accept every case that walks through the door. You know, there's cases that we look at and say, you know, this is probably beyond our scope, we need to send you to a surgeon. And again, probably 9 times out of 10, the patients that come in do really well with the traditional care, but for those that don't respond as quickly, you know, decompression and traction is a really, really good option. So again, Ray, thank you so much for sharing your story.
Thank you.
Yep, of course.
You've been awesome.
I appreciate
you really
it.
have.
So guys, make sure to comment. If you have any questions, please feel free to reach out. Make sure to like, share, and comment on this video, and we'll be back soon. Thank you.
Thank you.